So welcome back to the Fenton Family Dental Channel. Today, you're coming in to get an implant placed. This can seem a little bit scary. Someone's going to be putting something into your bone. But if you can believe it, it's one of our least problematic procedures in terms of pain during the procedure and pain afterwards. What we'll come in and get you to do at first is just get you seated. We'll get some topical, some jelly. That jelly kind of just goes on there and makes it so that the numbing injection that we give is going to be a little bit more comfortable for you, so you're not suffering through that. We're going to give you some of the anesthetic. That'll take 5 to 10 minutes to soak in. Some patients ask me to wait a little bit longer. I'm fine with that. Some patients ask me to give a little bit more anesthetic. I'm fine with that also. So what we'll do is we'll get you seated, do those things, wait that time. We will most likely have a surgical guide that goes with a CT scan that shows us exactly where to place the implant, and we have a custom selected implant for that situation, for your situation. We'll place that. Placing the implant takes 5 to 10 minutes and you'll be done. At the end of that time, what we'll do is rinse you down with something called chlorhexidine. Make sure everything's super clean, clean up after ourselves, and we'll even do some chlorhexidine during the procedure. At that point, once the implant's placed, you are ready to go. We don't want you to mess with the area. Remember what we're trying to do. We're trying to get this titanium piece to find a nice home inside the bone of your body. And if any micro motion, anything touching it, micro motion is our sort of industry word that we call it, anything disturbing that area is going to move the implant on a microscopic level. If it does, the cells that we want to grow around that will not grow. If they don't grow, other types of cells will grow and the implant will just be floating in space. We don't want that. So anything you can do to stay away from the area is best. But it's a pretty easy thing to deal with. We may give you some antibiotics. We may give you some pain relievers. You can certainly take over-the-counter pain relievers to relieve any pain that you're having, but you won't need much more than that. It's a very surprising procedure for most patients to go through. So go ahead, enjoy the procedure. Let us know anything that we can do for you, and let's get started. See you.